House Bill 1395, Youth Mental Health Services Act of 2019. By Chrissy Starnes, RN, for the University of North Carolina, Wilmington, Nursing 398, Module 7, May 1st, 2019. Introduction. House Bill 1395, the Youth Mental Health Services Act of 2019, which would amend the Elementary and Secondary Education Act of 1965. This bill would aid in updating an existing bill to better reflect the current reality of today's schools and the children they serve. Its goal is to free up funds to improve mental health services available to students kindergarten through 12th grade, to prevent children with mental health disorders from slipping through the cracks and therefore going undiagnosed and untreated. There are multiple different health services this bill hopes to fund, including the hiring of school nurses and school psychologists to ensure best practices for mental health first aid in our students, identification and assessment of children in our school systems and behavior and mental health needs, the organization of school and community resources to serve the children once diagnosed. Additionally, these funds could help schools create and implement safety and preparedness plans for active shooter school violence scenarios with local law enforcement. Background and significance. This bill is at the federal level and is in the first stages of the legislative process. It was introduced on February 2nd, 2019 to the House of Representatives and was subsequently referred out to the Committee on Education and Labor. It still needs to get through the 7 other steps of the legislative process, including committee consideration, calendars and scheduling, the House floor, the Senate floor, executive business in the Senate, bicameral resolution, and presidential action. This is a bipartisan bill sponsored by Representative David Rowe from Tennessee and co-sponsored by Democrat Representative Earl Blumenauer from Oregon. This bill proposed to amend multiple previous bills, including the Elementary and Secondary Education Act of 1965, the No Child Left Behind Act of 2002, and the Every Child Succeeds Act of 2017. These amendments would help update these acts to fit into our current climate and free up funds related to childhood mental health, school violence, school emergency preparedness plans, and telemental health resources. Currently, there are no persons or groups to have spoken out or who have declared any opposition to this bill. Literature review. Mental and behavioral health issues in children have been on the rise for decades, and a national and independent nonprofit organization in the U.S. reports that it affects over 15 million kids a year. That's more than the number of kids with cancer, diabetes, and AIDS combined. An article by the Center for Disease Control and Prevention reports that 1 in 5 American children ages 3 to 17 have a diagnosable mental, emotional, and behavioral disorder in a given year. However, only 20% of those kids are ever even diagnosed, let alone receive treatment. That leaves 80%, nearly 12 million children, who are not receiving the mental health treatment they need. So who should be recognizing the problems in these children? Parents, teachers, doctors? Often, parents are too close to the situation and are more likely to write off signs as tantrums or a bad day. But also many parents simply do not know or recognize the signs and symptoms of mental illness in children. Our teachers are already overworked and underpaid for the many roles we expect from them, while children's doctors only see them for a handful of times a year for brief appointments. It is school nurses and school psychologists who have the education, experience, and training needed to be able to identify these issues in children. Unfortunately, statistics also show that 25.2% of schools in the U.S. do not have a school nurse, and 35.3% only employ one part-time. As for psychologists, There is only one school psychologist for every 1,482 students in the U.S. A study by Serving-Yashi and Yang and posted by the CDC stated that if untreated, mental health disorders in children will follow them into adulthood and often result in unemployment, substance abuse, and criminal behaviors, which puts an increased burden on our social and disability programs. The Child Mind Institute added that the cost of the lost productivity and crime spending related to mental illness in Americans aged under 24 is around $202 billion. And that of the young adults in the juvenile justice system, 70.4% meet the criteria for a psychiatric diagnosis. And more often than not, mental illnesses in these populations aren't even identified until they are already incarcerated. This bill will also designate funding to help schools establish and implement active shooter and campus emergency preparedness plans with local law enforcement agencies. The Center for Homeland Defense and Security found that 2018 saw the greatest number of school shootings incidents in the U.S. since 1970, with the highest number of victims killed. With statistics like these, it's no wonder issues like depression and anxiety are increasing in our nation's most vulnerable population. Taking the time to create an active shooter plan and then practicing it on campus, just as we do a fire or tornado drill, can help students regain trust in their school setting and hopefully help them to feel safe at school again. In regard to funding an emergency preparedness plan on school campuses nationwide, the representative sponsoring this bill, Tennessee's David Rowe, has been quoted as saying, "Establishing plans, making agreements, and coordinating services can expedite things and possibly save lives." Discussion. If this bill gets passed, it could open up many new nursing and psychology positions in schools. There would also likely be an increased need for more pediatric psychologists, as well as more programs and treatment options for children and adolescents, once more are being identified and diagnosed. If the bill gets passed and the funds used in the school system are used as intended, research would then need to be done to determine the efficacy of the services put into place. Studies would need to be done examining the effectiveness of school nurses and psychologists at identifying and helping students with undiagnosed mental health issues, as well as research into how these programs have changed and affected student outcomes. Although determining the effectiveness of emergency preparedness programs will be hard to do, surveying how safe kids feel in school now versus how safe they felt before the implementation of the program will be needed also. Before all of the programs can be introduced, if this bill is enacted, there will be a great deal of education needed. Education of the students, parents, general public, teachers, administrators, and even the lawmakers. They will need to learn what services are now available and the type of students they are looking for, as well as how to refer a student to the school nurse or psychologist. Parents and students would need to be educated on the different rules of confidentiality that applied and what their rights would be. The most important and hardest aspect to teach, though, will be educating kids and parents on mental health issues in general and attempting to erase the stigma associated with them so that students and parents will be more willing to accept the help offered to them. Overall, this bill getting passed will bring much needed attention to the mental health problems and needs of students in the U.S. Conclusion. House Bill 1395, Youth Mental Health Services Act of 2019, is a bipartisan bill at the federal level. It is only in the first step of the 8 steps of the legislative process. The amendment proposed would help update this act to better fit into our current climate and conform to the needs of today's students. These funds are needed because mental health disorders are an ever-present and increasing problem for students in the U.S. grades K through 12. The majority of affected students are either undiagnosed or diagnosed but untreated. Passing this bill could provide funding for the improvement of the mental health services available to students by enabling more schools to hire nurses and psychologists who would play a major role in the recognition and identification of students with mental and behavioral health disorders. Funding from this bill could aid in the organization and use of school and community resources available to these children. Also, funding to plan and implement school violence/active shooter preparedness plans with local law enforcement agencies and to help with the coordination of these services. Untreated mental health disorders in children lead to untreated mental health disorders in adults, and these adults are more likely to be unemployed, incarcerated, have substance abuse issues, or even commit suicide. This has become a large burden on the U.S. References. Thank you.